Welcome to the Hearing Wellness Journey podcast, an exploration of determination, hope, self-discovery, and triumph. We'll share the personal experiences of those that are living with hearing loss and provide a haven for their stories to show others that they are not alone in this journey. Please welcome your hosts.
Welcome back to another episode of the Hearing Wellness Journey podcast. Today, we're going to address something that we have stumbled upon in the practice, is that our female patients tend to have different unique needs than the male patients. And we want to drive into the science of how our ears and tinnitus and foggy brain can all be related, especially as women's hormones are changing, especially at certain times of a woman's life as they transition from normal cycles to menopause. And even post-menopause, women aren't small men. So we should start with Dr. Johnson. She is more versed than some of us into how different hormones can affect the ears. Do you want to start with that? I find it so interesting that I didn't realize that our hormones could affect our ears.
Yeah, there's been some research into estrogen, which we primarily know as regulating our menstrual cycles and the female reproductive tract. But there's also been some research into estrogen being a protector, barrier, enhancer, if you will, of the inner ear, our cochlea, and specifically more so our outer hair cells. And it has been shown that women's inner ears actually have more spontaneous otoacoustic emissions, which are the little echoes that we measure back when we put two sounds into your ear and we measure what our inner ear sends back to look at the outer hair cell function. And it's also been shown that females have shorter latencies on something called an auditory brainstem response evaluation. And that shows that our systems work a little bit faster compared to male systems. And they've looked into the link of estrogen because we know that's obviously higher in the female population. And one of the things in grad school that you learn about is something called otosclerosis. And one of the telltale things that they tell you to look for is hormonal changes in females can be a big trigger to the onset and the starting developing of otosclerosis. A lot of it starts during kind of mid-30s, during peak reproduction age. And pregnancy is a big one that can trigger the hormone shift that we can see with otosclerosis. While men can have otosclerosis too, it is definitely female dominated. And usually the hormone trigger is one of the more common reasons as well. And I think that's just really interesting because we know with pregnancy, your hormones change significantly if you've been pregnant. And there's a whole bunch of things that change in your body at baseline. And you know what? Let's add the ear on top of that too.
Yeah, right. Or let's say you're not having babies anymore and you're just having lack of sleep. Dr. Micaelides, I know you've seen a lot of patients who, if they don't get sleep, they suddenly have raging tinnitus. So what came first, the tinnitus, the lack of sleep, or a hormonal disruption?
So I have to be honest, I'm closer to my 50s, and all of my friends at one point in time have come to me to get their hearing tested because they feel like they're just not hearing as well as they had before. And I feel like that's with going in perimenopause, closer to menopause, that I find that I've had a lot of friends, and their hearing still can be in the normal range, but they're definitely noticing a shift. Otherwise, they wouldn't be coming to me for this, really in their 40s and 50s.
Yeah, during that time, there's a fluctuation. You don't have a normal cycle. So sometimes you have estrogen, sometimes you might not. Sometimes it's more or less. Not feeling like yourself can trigger these things at any age. You can be before that time where you're just not sleeping well and suddenly something's keeping you up at night and you're hearing ringing in your ears. I feel like we should dive into this more and ask more patients about this, and maybe even just have a questionnaire for them and start to collect our own data, because I don't think there's a study out there. They don't seem to test and study women like they test men. right? Like, is everything that we have in this office based off of a study from a man?
Yes.
Absolutely. I mean,
Yeah.
even the 0 dBHL study was young men.
Yes.
And I mean, that is like the standard that we've used forever.
Yes.
And
As a
nobody's updated it. Nobody's interested in updating it. And we're just like, oh,
no,
men,
but
that's what we're based off of.
we're 100% female practice, and we work with men and women. And so many people just assume, they're like, oh, most of your patients are men, right? Only men have hearing loss. And I'm like, that's not true. I need to look it up, but I feel like we have more women than men as patients. And we do need to start our own questionnaire study asking, when did the tinnitus start? When did the hearing change? How old were you? Were there fluctuations? Did it seem like it got better or worse? Is it experienced differently?
I find that a lot of the women will come in sooner
Mhm.
with a more mild hearing loss, actively trying to help their hearing, versus I find men, usually someone's telling them to come in, usually the wife or, so I find that they'll come in with more mild hearing loss, which is good though.
Yeah. I think we just talk more. And it's a
More
fact.
social, yeah.
Socially, women communicate when we have a discussion with someone, or during the day we say 30,000 words and men will say 7,000 words. If we're trying to have a conversation with a girlfriend and we can't get all of the information, we're handicapped or realizing that there's a problem sooner.
Right.
Even with a mild hearing loss, we're noticing it. But I am curious, at what age does the typical woman start to notice a change versus the typical man? And then we have environmental factors. We all know men tend to participate, boys, we'll start with boys, tend to be more risk takers. They tend to, and it depends on where you live in the country or the world and things, but they tend to be more likely to use power tools, let's say, or ATVs, or even just out in the country hunting, where the women typically are staying home, or men are the ones, if depending on your family, they're the ones that do yard work and the women stay inside and do housework, right? But if all things were equal and you had men and women in the same house exposed to the same sounds, which one gets help sooner? Like you said, probably the women. We really, really hang on to conversations, stories, our girlfriends, just family times. But then there's some that don't do something, but maybe because they didn't know. So maybe we can dive into that. What's happening if someone isn't sleeping well and they can't seem to hear their family? What should they do? How are we different in seeing them versus someplace that is a typical retail store, cost cutting warehouse? How are they going to treat them as just a typical person who comes in based on the male guidelines versus our practice?
I mean, I think in the private practice setting like ours, we tend to look at the big picture more, I guess, like a whole body approach, and how we can work with other providers, and what else are you doing, or what else are you treating? Are you treating perimenopause, menopause? Are you working with a women's health doctor? Are you working with a cardiologist? That's what makes private practice different, because we do try and make this
not cookie cutter, but
right,
tailored. And we start
Yeah.
with their video intake. Like, how long do you guys take when you take a history with a patient, even before they arrive?
15 minutes, you mean? Yeah, about 15.
What other places take an extensive medical history for 15 minutes before they start that appointment, before they even walked in the door?
I think that is my appointment length.
I know, right? Yeah.
Oh, yeah.
That is all the time I'm allotted, yes.
You know what I mean? I'm in, vitals taken, I'm out.
Yeah, right? Or if you go into a Costco or you go into a retail store, they're all about, well, let's find out real fast, what kind of hearing loss do you have? And then they're already making assumptions. Our providers that are down at Costco near us are pretty good. And what they have available to them is good technology. But the reason why their prices are so low, and I'm sorry, my brain's going on this, but because they can pre-order, let's say 100,000 hearing aids, and they get a really good price. But guess what? It's 100,000 of the exact same hearing aid. And it's the assumption that you're fitting into that 80% of those who it's good enough to get exactly what everybody else got. And it's tweaked for you a little bit, but I feel like every time they come in, everybody has the exact same size dome with the exact same large filter, and it's wrong. But they're pulling stuff off the shelf and they go, here, try this. This should be good enough. It's not over the counter, but it's just, there's a template, and do you fit into this? And is it enough? And then here, gosh, it's so much different. Like,
It's not a one size fits
it's
all.
not. We're buying stuff for people, and we're ordering custom parts, and we're
And
using
real ear
realer
measurements, which they
realer
don't.
measurement. Do you
Yeah.
guys want to talk about what realer measurement is?
So I always joke with most of my patients that like everything in the world of audiology is based on an average man. And statistically speaking, that's true. All of the formulas and everything, it's based off of a mannequin called Carl, who is
Or
based
Kemar, his cousin.
Kemar.
Yeah.
There's a few of them, but ultimately it's an average man-sized ear canal. And we all know that not one of our patients is average, and not all of our patients are male. And those that are, we still do real ear measurements because everybody's ear canal shape is different, even between ears on the same person. I always say they're cousins, they're not twins. And sometimes they're not even close enough to be siblings.
Nope.
And
They were adopted.
sometimes they're real curvy and the other one is just a straight shot.
Yeah.
And so what real ear measurements is, we put this little tube into your ear canal and we actually measure the appropriate depth that it's supposed to sit at next to your eardrum. And then we measure how different your ear is compared to the average ear. And then we save that in our computer. And then we also will then put your hearing aids on top of that tube to measure the specific output of your hearing aid in your ear canal. Because while the computer system does a great job, it's all based on statistical averages that they have found in research. And we want to make sure that those hearing aids are not doing anything funky in your ears, whether that's under or over amplifying information. And sometimes those ear canals are much larger than average, so you're actually not getting enough when we're set to just the computer settings. Or if you're
much smaller,
petite
Mhm.
and you got a little ear canal,
Yep.
even though the computer system says you're right where you're supposed to be, when we measure it, we're like, oh, whoa, that's way too loud. Let's back that off. And that way we're taking the guesswork out of things. We don't have to wonder, oh, what exactly is causing this patient's complaint or what they want fixed. We're measuring it so we can fix it. And better yet, we're going to show you.
Yeah.
We'd be like, look, this is what it's doing. Or if you were fit somewhere else and you come in, I love doing comparisons of like, this is what you've been walking around with. And this is what it should have been. And this is why maybe things haven't been as successful as you had hoped for.
Yeah.
And it's a really nice objective tool that is a foundation. And then we adjust it from there because you're a human with preferences. So even though our system says this is exactly how you're supposed to be, we then customize it to you as a human being with all of this newfound information. And it really just gives us the luxury of being able to fine tune something specific for our patients
yeah, it takes out
themselves.
the guesswork. There's no guesswork.
Right.
No guessing.
Mhm.
Yeah. And then if people are feeling more comfortable, they don't have a weird zappy, screechy sound that they can't explain to you, and you don't know where that came from because we never visualized how you're hearing, you know. They get it right, they go home, and the stress is less. They can hold easier conversations. They can relax and just watch a show. They can go play cards or go to an art class, go for walks outside with their friends and things. And then they sleep better at night because they've actively been getting out their social. And I don't know how to describe it, but there's that underlying stress. If things aren't going well and you don't realize you're holding your breath and you're trying to keep it all together and you're trying to hide from the world that something's not quite right. And then that's when it leads to these sleep disorders. But Dr. Micaelides, can you talk to us about how a sound in your ear is not a diagnosis, it's a symptom of something?
Meaning,
Like tinnitus. How many people think, oh, I have this and it's just tinnitus, but it's not usually. Something changed.
yeah, usually there's some sort of damage to the system in some way, shape, or form. And when that damage happens is when usually you can have that sound. But it really depends. And it can be any kind of sound. People say buzzing, chirping. There's a lot of different ways to describe it. That's what encompasses tinnitus. And what happens is when it becomes bothersome, that's when they usually come in to see us. When they really are up and not sleeping, that's when we would come in and do a hearing test, see what's going on. Sometimes within that 250 to 8,000 hertz, there might not be any hearing loss, but there's still some in the higher frequencies because we do hear higher than what we test in office.
Yeah.
So there can be damage to that system farther out, and that can bring.
Absolutely. So even if you're not having a hearing problem, you don't think, but suddenly you start hearing something, come in for testing.
Mm-hmm.
Dr. Johnson, do you want to address the adult that's having processing issues? Something's not quite right.
Yeah. So I frequently see this. People will come in, they're like, I'm having difficulty hearing. I can't hear in restaurants. I've been elsewhere. Everybody says that I'm normal. Everybody struggles in background noise. To an extent, background noise is difficult for everybody. Multiple people, attention, other executive functions come into play here. But then when we do a hearing test, it all comes back within normal limits. So looking at just the peripheral system, so you hear the beeps, you raise your hand, you push the button, that's all normal. Speech and quiet, normal, no problem. We add some background noise and they fall apart. And it's like, oh, wow, okay, yes, there's definitely something going on here, which can be the most validating thing for these people because they've gone multiple places, they've looked it up online. Like, no, if you have a normal hearing test, you have normal hearing. But we have to remember that our ears are simply funnels to our brain. And where that all gets processed is in our brain. And so sometimes I'm having adults come in who are getting assessed for auditory processing disorders, where in grad school, it was like, oh, this is kind of a pediatric thing. Right. And like by the time you're an adult, you've probably figured it out by then. And I'm seeing all of these adults in workplaces, especially post-COVID, where they're like, when I had to work from Zoom and from home, it was quiet, it was lovely, no problem. But now we're in this trendy open air workspace. And so there's a lot of background noise, even if it's not super loud, it can be very difficult for people. And then we're like, okay, there's something going on with auditory processing. Even though your audiogram is normal, you definitely do have difficulty hearing, and here are some things that we can do, whether it's compensation strategies or low gain devices, modifying how you host meetings in the workplace, how you speak to your boss, things like that, to help people be successful. So if you've been told there's nothing wrong with you, seek out a second opinion, because there might be something going on in the background that we can address and discuss.
I mean, isn't that the typical woman who feels like they've complained, they've talked to a professional, like, you're normal, but this person feels like something is changed, something is not normal. More and more women are starting to say, hey, I feel like this is something that we shouldn't have to suffer from. Some people get hormone replacement therapy, some do not. If you have a symptom of foggy brain, you don't feel like you can process anymore, is that something that could be evaluated? When everyone said, oh, you just have to deal with it, there's nothing that's available. Or you suddenly have, or you have tinnitus.
We're told a lot that there's nothing to be done.
Yeah, they were told nothing can be done for tinnitus. Well, what if you're a woman and you suddenly have tinnitus? What if you are someone that was always doing well at work and suddenly you've got foggy brain, you're not sleeping at night, things are just not normal. You have anxiety, you're worried about having conversations, or just, even if you're pretty good at what you do and you're presenting and you can't understand what the audience is asking you, you feel like you've hit a level where you in your job can't move forward, or you've hit this glass ceiling or something. And we need to work with women, but also their medical professionals to say, hey, if someone has these symptoms, have them come in. Maybe they do have normal hearing. Maybe they don't have normal hearing. When was the last time women had their hearing tested? Even just for a baseline, but we need to look into this more. How about women that are receiving hormone replacement? Have they been able to maintain their sleep levels? Me, myself, I never had a sleeping issue. I could fall asleep sitting up. I could fall asleep in a car. I can fall asleep in an airplane. I can sleep anywhere. And then suddenly my body went crazy last year and I wasn't sleeping. I was all over the place, hot flashes, you name it, whatever. And the tinnitus and the foggy brain, and I can't focus. And it's just crazy. And then they got me back to stabilizing and I'm a normal human being again. Well, relatively. But it's still crazy.
More normal than before.
Yeah. But right, there are so many people that, or providers that were told, this is what we know and that's it. But why can't we ask, but what if there is a link? What if we could be helping more people? We help so many women already, and they know we treat them as an individual. We don't treat you like a small man. So if you have any of these symptoms, it doesn't hurt to have testing done. The testing, if nothing else, is a baseline because it's probably the first time you had your hearing tested since grade school.
Yeah.
So if something does just suddenly change out of nowhere, what if you have chemotherapy treatment and you think, well, that's not related to my ears? Treatment 10 years ago can affect your ears. What if you had a concussion, a car accident? What if you suddenly have Parkinson's disease or MS? Have a baseline, first of all, so then we can then track how you're processing. Or if something's changed in your ears and you now have tinnitus. You said at the beginning of this podcast, Dr. Johnson, that women tend to have, I did not know this, tend to be more likely to have spontaneous otoacoustic emissions, meaning that your ears are making noise just for fun. Right?
They're just having a good time.
Having fun. And what if you've never known that that's just a thing and that's you and it's okay? What if you were never told, okay, everything's normal, and you're like, yeah, that's just me, and you just move forward, as opposed to always wondering, is something wrong with me? And then if that changes, then we can reference back to what we know.
Yeah.
Yep. And we're all, I mean, getting back to your graduate school days and my graduate school days about auditory processing disorders. It was supposed to be just a pediatric thing. We're all big kids, or you just weren't diagnosed as a kid. How many people are now diagnosed with ADHD and they probably always had it? It just wasn't investigated. Yeah.
It didn't spontaneously start at 28, 29 years old. It was just an awareness thing. And you're like, oh, okay.
Yeah,
that makes sense.
absolutely. But like, we definitely in this office are all women and we're sensitive to women's needs. And I do think we should start our own soft study, having some questionnaires and asking when did this start, about what age, and asking about hormonal cycles as opposed to absence versus present, normal hormone levels, and even see if we can pull in some endocrinologists, if not even just medical doctors that specialize in women's health, menopause, perimenopause, and postmenopausal treatments. Because we can't make assumptions on how someone is dealing with their ears. And then we didn't even touch on the fact that your inner ear is also your balance system. So even if you have a mild hearing loss, you're 3 times more likely to fall. And now studies show that if women fall, they are more likely to break and find themselves in a rehab center and then trying to rehab because they were not as strong in their bones as men, and we don't want you to trip in the first place. And if you're not aware that your inner ear changed and your balance, your vestibular system is off, you need to just be aware. So you go, oh my gosh, I'm going to turn on the light. Oh my goodness, I'm going to make sure my feet are feeling the padding or the tiles of the flooring. Because if we fall,
I know.
we can break. I fell this year. Firsthand.
Yeah.
I know it. Actually fell twice this year. You know, I fell on the hike. Yeah. I didn't break that time though. Just my pride broke.
Luckily, that is much
And
more
there's only one
easily
witness,
repaired.
so I didn't actually have to tell you, but I fell. Yes. Yeah. So I don't know. I think it's a good podcast that maybe we bring in, or I don't know, we could even have an entire day or a summit or a series all about this and dive in deeper because we're just asking questions. We need the experts to come in and help us to understand more so we can treat our patients better because there's not enough research on women. And we actually are a greater population than the men. Aren't there 52% of all human beings are females? 48 are males.
I do
We
think
have
the
a high,
majority. I'm not sure on the exact stats.
okay, there's a lot of us. And especially as we need to make sure that we're not just cookie cutter treating everybody the same way. Oh, you have a sensory neural hearing loss? Okay, you get the same thing as everybody else.
Right.
Different needs, live in different places, different families. Have you ever had an Italian patient? Italian background, and they go,
Yeah.
I don't need hearing aids. My whole family is so loud. You know, versus others, they come from a quieter, soft-spoken family. Those people come in more likely to try to get hearing aids because their family is quieter.
Mm-hmm.
All right. Any parting words, anything that you can think of, say, if it was you, if there was some kind of trigger or symptom, why would you schedule an appointment with an audiologist?
I feel like every person should schedule. It's just like
Yeah.
getting your eyes tested. Why is there so many people, even in schools, you're required to go and get your eye tested? Same thing. If you're, even like mid 40s, come get a baseline. Come see us, get a baseline, and then we can go from there. Because if something does change, we know at least where you started, even if it's completely normal. Right. So
If your intuition feels off and you don't feel heard by a provider you went to see, seek a second opinion. Do not just let it go and take it for granted because so many women for so many different things historically in medicine have been written off as something else. And then 1, 2, 3 years later, it comes back that it actually was something a little bit more concerning than just anxiety. So always seek out a second opinion if you feel like you didn't get the answers and you didn't feel validated. One of the luxuries in our office is we have time. Our appointments are scheduled for that length for a reason to make sure that we can fully test everything we're looking for, which honestly is more than just a regular hearing test. So even if you've just had a regular hearing test before, but you're like, I don't know, I'm still struggling way more than I think I should be. Let's see if there's something else that could have been missed on just a regular hearing test.
Right.
And in addition to just, we have more time to test, we have more time to go over those results as well. And to really take a comprehensive history prior to you coming in so that we've got more time for that, which also gives you not just, oh, it's normal, you're normal, when you hate being told that and you feel like something is
Not
not quite
normal.
right and not
Yeah.
normal.
And we don't just test in quiet. Our comprehensive involves speech and noise, which is usually the issue. And then if you don't do well in that, or depending on the pattern, we can then schedule you for a different day to do even more testing, like Dr. Johnson was saying. Test the auditory processing portion at a deeper level because there's so many different ways that the breakdown could be, and we wouldn't know if we didn't test. Kind of like a neuropsychologist. You could do a basic IQ test, but they dive in deeper and find out if there is an issue. Where is it? Is it executive functioning? Is it, your processing speed? Or is it your short-term memory or long-term memory? We can look into that on an auditory level. So you don't have to suffer. Definitely, I agree. Have a baseline test done. And then we just monitor you from there. If it turns out everything is fine, or you feel like everything's fine, come in. Or maybe bring a friend that you're worried about. Have your testing done together. All right, so tune in as we dive into this deeper and try to answer some of these questions of if you were to have hormonal changes, you're going through a certain period in your life, you're only halfway done to 100, right? And things are different, but you feel like you should be sleeping better, you shouldn't be bothered by your tinnitus, or you shouldn't be having foggy brain. Is there something we could test for? And then once we find the problem, we can help you through that because it's just a temporary season in your life and there's no reason for you to suffer or be gaslit and say, oh, you're fine. You're histrionic. That's what they used to diagnose women as. They were just hysterical. They were histrionic. And they need to just stop complaining rather than look into it. And there's so many different variables, and they actually could be treated. 2025, we are definitely helping people with what they have, and we have fun with it. So start just talking to one of us as a video intake. We'll take your history. We'll go through all the systems of your body, making sure everything's good. We didn't miss anything. I don't know how many times I've put things together that no one else did because no one else took the time to take the proper history. Just curious about the individual that we're chatting with. With that being said, make sure you listen to an audiobook today or your favorite music, smile, and we will see you next time.
Bye.
Bye.
Thank you for joining us on this episode of the Hearing Wellness Journey podcast. For more information about what we do and the services we provide, please visit our website at hearingwellnessjourney.com/podcast, where you can find more resources based on today's discussion, as well as request to be a member of our Hearing Wellness Journey community on Facebook. That's available for our listeners exclusively on hearingwellnessjourney.com/podcast.